Hi, this is Aliky from the Healthy Gut Expert Summit, and today we have a beautiful guest, Dr. Jill Carnahan. Welcome.
Thank you.
Look, it's such an honor to have you here with us today. So if you got your pen and paper handy, please take notes because we're going to go on a small journey here. And I want to be also conscious of Dr. Jill's time because she's in between patients. So thank you. I feel very privileged. Of course. So if I may, I'd love to introduce you to Dr. Jill. She's not only a functional medicine expert, she actually uses it to help you and help you find the answers to the cause of your illness. Nutritional, whether it's biochemical, nutritional imbalances that could actually be making you feel ill. What I love about what Jill does is she searches for a lot of underlying triggers that are contributing to the illness through lab testing and tailoring a specific protocol for you. And with that being said, I would just love to dive in and just learn a little bit about you and your journey because it's really beautiful actually. So share a little bit about your background.
You bet. So I went into medicine just to heal people and actually always had the heart of a naturopath, but I went into allopathic medicine and at 25 years old, I got the diagnosis of breast cancer. So very suddenly took a leave of absence from medical school, had all kinds of multiple surgeries and chemotherapy, 3-drug chemotherapy and radiation. And I mentioned this because chemotherapeutic agents are so toxic to the gut. And so I probably had a genetic predisposition towards multiple gut types of things, which I'll tell you in a moment. And then that chemotherapy kind of took me over the edge because 6 months after I finished all of my treatment for breast cancer, I was diagnosed with Crohn's disease. And very serious. It was at that time almost life-threatening. I was losing weight. Was very malnourished, very, very sick, bleeding, diarrhea, weight loss, pain. And in hindsight, it all makes sense. As functional medicine doctors, we look for root cause. And so I had this genetic predispositions, actually celiac disease genetics. So at that time, I was eating a gluten-full diet. I was actually a vegetarian, but I joke it was more like a carbitarian. Lots of grains, lots of processed soy, like all the wrong foods for the gut and didn't even know it. And then I threw in chemotherapy for breast cancer, and my gut just was disastrous and got the diagnosis of Crohn's disease. And so I love looking for these clues because for me, gluten was absolutely kryptonite and toxic. And then after that, the chemotherapy, a lot of the chemotherapy drugs actually work by increasing intestinal permeability. And we know that that is so toxic because you have a process called endotoxemia, where the contents of the gut, like the bacterial coatings, can leak into the immune system and cause massive inflammatory response. So once I got Crohn's disease, I saw a gastroenterologist, and he told me, Jill, diet has nothing to do with this. And I didn't know very much at that time. I was a neophyte medical student, but I knew in my heart. Yeah.
Like as in to have so much happen to you in your early 20s.
Yes, I was so young and it was crazy now that I look back.
It's quite daunting actually at that age. Yeah.
Yeah, because you think you're invincible until something happens. But I remember the doctor looking at me and saying, Jill, diet has nothing to do with this. And I was just like, I'm stubborn. And I was like, that cannot be true. I'm going to prove you wrong. I fired him and I went looking for science. Awesome. And I actually came across the Elaine Gottschall specific carbohydrate diet. And I didn't know much, but I'm like, what do I have to lose? And so I went on that diet, which happens to be gluten-free and mostly grain-free. And I was literally symptom-free from my Crohn's disease within 2 weeks. And I wasn't cured. It took me a lot more years to cure myself from Crohn's disease. And yes, I said, cure myself. I have no signs or symptoms of Crohn's disease. It's curable. And I'm living proof. But the diet is a huge piece of it. And that's where my story starts and why I'm so excited to talk about the gut.
Thank you so much. For anyone listening, hopefully this brings a ray of hope to your day because it's certainly, I can sort of hear you now. Anything's possible. And a stubborn personality is one that is persistent and relentless in her quest. And I get that from you. You are awesome. What a lot of courage. Help share with us, like, where do we start first identifying? That's complex. That's like would be considered a complex case. What are some of the symptoms and what is the best way to start navigating which one to address and where, to get to root cause of that needle mover that's going to have the effect on what can we do or consider or learn about?
So this is huge because I now, because of my heart and what I've done with my own body, I see a ton of Crohn's and colitis and inflammatory bowel. It's probably one of the favorite things I see because a lot of other docs are like, oh my gosh, this is so complex. What do we do? It's incurable. And I'm like, no, it's totally treatable. So where I start is always kind of two pieces, infectious and toxin. So, and we're looking at the microbiome. So first thing we're looking at is just balance of normal microbial inhabitants, lactobacillus, bifidobacter, and we actually do stool testing to assess the microbiome. Because what happens with Crohn's disease, especially, probably more so than ulcerative colitis, is it's a genetic predisposition towards an abnormal immune response to normal inhabitants. So what that means in common language is the immune system is very reactive, and it reacts overtly. It reacts overly reacts to normal inhabitants. Sometimes it can be like excess Klebsiella or E. coli or something that's normally there, but in excess. But this is not always a pathogen. It's not always that you get salmonella or that you get hemorrhagic E. coli. Sometimes it's just normal bacteria. It could be small intestinal bacterial overgrowth or small intestinal fungal overgrowth,
Yeah.
SIBO or SIFO, and those are actually very, very common and coexistent in Crohn's and colitis. And then what happens is that body starts this immune response that typically involves some of the leaky gut or permeability, because that's how the gut bacteria contents cross over into the immune system. And the process starts an inflammatory response where the body's like, whoa, we don't like this, let's react. And they start an inflammatory response trying to eradicate something that really isn't a bad thing. And then by doing so, they cause collateral damage and damage to the lining of the gut. So this is super common. And my job is to say, what triggers are there? We know the genetics, there's lots of genetics that predispose people to celiac, Crohn's, and colitis. Those we can't change. But what we can change is the body's response to a trigger. And so my job is to say, what are the triggers? How do we rebalance the gut and reverse that trigger? Now, sometimes there are things like parasites or severe Saccharomyces cerevisiae overgrowth. There are other things that can be there that are more pathogenic and infectious. Yeah. And we know certain triggers like Klebsiella and Clostridia and Saccharomyces cerevisiae and Giardia are really, really bad players in Crohn's or colitis. And now we know there's a new microbacterium, avium, that is often in cow's milk and can be a trigger. It's almost like a tuberculosis type of bug, and that's another trigger. So my job is to look for infectious triggers, eradicate them or rebalance the gut, because often when those triggers are removed, the gut can calm down and regain normalcy.
Rebalance and regain normalcy, as you said, and looking for the triggers. And is that done through like tests and bloods and specific markers that you're looking for?
Yeah, most everybody I see gets a stool test, and I have 3 or 4 companies I use. They're all slightly different. So I'll start with, maybe Genova's or Doctor's Data or Diagnostic Solutions. Those are some of my favorites. And then try to gain data from that. And then the other thing I'll do is our urinary organic acids, because that tells me about markers of yeast that might be in the small bowel, markers of bacteria that might be in the small bowel. It tells me about oxalates, salicylates, ammonia, stuff that can play into that as well.
And it's interesting because you work with a lot of the same cases. So you're actually, you know exactly what to look for. Yeah. And you can almost probably just, see it when it walks in the room on exactly how you're going to treat that person, go down that path to find the triggers and start to hopefully eliminate them. And then, rebalance. Wow, that is incredible. So there's some of the way to symptomatically identify. Now, when they're identified, and you said also look for the infections or get rid of the infections, what's that process? Because the body's been used to suffering in a way. What happens with that transition to then cleanse that out or stop the triggering and come up to more normalcy and then rebuild and regenerate? How does that work for a lot of these clients? They're complex cases. In some cases, you've probably got 1 or 2 patients with 2 or 3 of the diagnoses.
Yeah. Very common. So typically what I'll do is that first visit, I'm ordering tests. So when I'm ordering tests, I don't always have that data the first visit, but there's a few things that we know are going to be good for everybody with Crohn's or colitis. So all of them I start on the high-dose probiotic. Typically that's things like VSL number 3 or Zymogen Probio Max 100 or any of the brands that are 100 billion or more per capsule.
Got it.
Usually a conglomeration of Lactobacillus, Bifidobacter, sometimes Saccharomyces boulardii, which is a good yeast that can crowd out the bad yeast. But any sort of combination high dose. VSL number 3 actually prescription is actually been studied for Crohn's and colitis, but I think it has cornstarch, so I'm a little more careful about the use of that in someone who's sensitive to corn. But probiotics are huge, high dose probiotics. Fish oil, huge. So as long as they're not having active bleeding, like in ulcerative colitis, I will often use a high dose fish oil. 2 to 3 grams is a minimum of
Okay.
EPA and DHA, sometimes up to 6 grams a day. We can go really high with that, and that's anti-inflammatory. And then there's good evidence with herbs like curcumin and boswellia for anti-inflammatory effects,
Yeah.
and for pain issues. So I'll often use those. If we're looking at healing ulcerative conditions in the stomach or the small bowel or the large bowel, you can use things like deglycerized licorice, glutamine, aloe, plantain. There's so many.
Oh my gosh, yes.
So we use all kinds, and I have combinations in almost every brand that I like, and use those, their powders and their pills, and so there's often some form of gut healing taking place.
Yeah, it's interesting. They're like very key herbs. And you mentioned boswellia, so that's frankincense.
Yes.
Right. Yeah. And then curcumin, and then the licorice and the aloe. Did you say marshmallow root?
Yeah.
Yeah.
Yes.
They're amazing ingredients, and they're awesome. Anti-inflammation. It's so soothing, beautiful.
It's wonderful. You can, my local Boulder, of course, there's so many natural things, and there's an apothecary where you can get raw marshmallow, and I'll have people just do a tincture in a glass of, like, a quart of water, and then sip on that through the day. So real marshmallow root in water, and it's so soothing. You can put a little vanilla or cinnamon if they want a flavor, and they love it. So super easy and simple, and through the day they can use that. So those are the healing things.
Yep.
Usually with diet, we'll put them on a specific carbohydrate diet or a autoimmune paleo diet. There's
Yep.
a bunch of different variations. GAPS diet is also important.
Yep.
So there's kind of variations, and we usually find what fits that person the best. But all of those can work depending on the patient. And then for very severe cases, when all else has failed, elemental diets are powerful. So this can be a medical food like Vivanox by Nestle. That's a medical food for elemental diet, or something like Absorb Plus, or what else is out there? There's a physician's formula elemental diet as well. And these are all just basically broken down foods into their basic form. And that is a cure for small intestinal bacterial overgrowth. And if they eat that only for 2 weeks, 4 weeks, 12 weeks, they will be cured. It's pretty amazing. It's very difficult because literally sometimes the only food source is in packets of powder. And so, but it really cures the severe cases, the elemental diet. It's difficult, but it actually...
It sounds like it's very concentrated and nutrient dense and based. And so with all the other things alongside it, plus you identifying the triggers, it would just absorb or ingest a lot better. And I mean, what's 2 weeks out? You know, if you've usually these issues, they've accumulated over time. That's why they've gotten to the point where it's almost, you just give up. Like, what else am I going to do? If nothing else has worked, how is it going to help? Wow. That's amazing. And so because you practice, which is great. So you've got online and resources and some beautiful things there, but also because you practice, people can come back and see you and check in with you. And so how does that protocol typically happen? How is the road to recovery, I guess?
Yeah, so typically first visit is just gathering information. I'm a detective, so I'm gathering all kinds of clues and ordering tests. And then based on any commonalities with inflammatory bowel, I do some of those things I mentioned, fish oil and probiotic, and vitamin D I didn't mention, but that's...
Oh yeah, vitamin D, of course, yes.
Yeah, actually D and A are critical and synergistic on gut healing, so often I'll do both of those. Probiotics, and so we'll start at the first visit and wait for tests to come back. Second visit, 4 to 6 weeks later, is the test results. We go over results and actually get a specific personalized plan based on that patient's microbes and findings. And then I'll check in with them every 6 to 8 weeks and make sure they're improving. We can follow things like stool calprotectin, which is a really specific marker for inflammatory bowel disease.
Mm-hmm.
So if that's high, I know they're not in remission. And if it goes normal, I know they're in remission. So I don't even have to do a colonoscopy to kind of follow that activity of disease.
Wow. This is phenomenal. Now, because of your own experience, I'm just going to ask you, because I'm curious, a lot of folks may be listening, one may even be in the same boat or know someone who is, or know someone who's got an aspect or percentage of that you shared. First, wow. Just to help cleanse your system out, or rather really recover and rehabilitate and regenerate, that's a lot to cope with at a young age for you as well. And of course, maybe age could have been on your side because you're in your 20s versus someone who's a little older. But what are some of the healthful aspects of general well-being that have helped you personally recover the way that you have?
Yeah.
and thrive.
When I'm teaching, I always say it's super simple stuff. It works the best. And for me, one of my mottos is clean air, clean water, clean food. Super easy, and yet it's profound. 80% of our environmental toxic exposure comes to the air. So if you don't have an air filter at home and work, you probably are missing out just by that toxic exposure. Clean water, huge. Filtered water. Actually, even though RO systems are really common, they are acidic. So if you do that, you need to make sure you're having minerals. I actually prefer the Berkey system, but there's all kinds of great systems out there for clean water. Mineral water and alkaline water can be beneficial as well. So like San Pellegrino, Perrier, some of the mineral rich waters from Europe are great. And then clean food. And clean food, gosh, I am militant about my diet. I don't cheat. I have no reason to. I feel so good, but I'm completely grain free. I am completely nut free. I am egg free, gluten free. But I have a really healthy, mostly Mediterranean style diet as far as lots of seeds and lots of fruits and vegetables. And so I'm kind of paleo style, but when I think of paleo, a lot of people think of, heavy meat and
Heavy meats and a lot of fat stuff. Yeah.
And I actually have a mostly plant-based diet. So I'm actually paleo, but I consider it mostly plant-based. So and you can do that. And I think that's such a key with ulcerative colitis and Crohn's is when you're first in a flare, you need well-digested foods and well-cooked foods. So broths and soups and roasted vegetables and things that are well-cooked. You would never want to do raw salads. But after you get well, the core of that, nuts, like a Mediterranean style diet would be ideal with very low grains for most people.
Yeah.
I'm a big fan of that. And so I think the food, and then I have all kinds of little things like I travel with a blender and an air purifier and things that I travel a lot, but I keep healthy and I don't mind doing a little extra things. I order from Whole Foods. They deliver to my hotel room so I can have fresh fruits and vegetables. But the way putting that extra effort and planning
makes a difference, doesn't it? And it becomes more sustainable. So thank you for sharing that. Now, another area that you mentioned is clean air, but then also you mentioned toxins too. So if I may, I know just from researching and knowing of you for a little while, mold.
Yes. So, and this is important because at the very beginning I said infections and toxins. We talked a lot about infections and microbiome because that's core, but honestly, I've had several cases of ulcerative colitis and Crohn's simply induced by a mold exposure. So this is really critical because most people have no idea their environment, like a mold in their home, could cause an inflammatory bowel or an autoimmune disease. But what happens with mold exposure is it stimulates the immune system in a susceptible individual to cause this inflammatory reaction, kind of like we talked about earlier, that kind of goes awry and it causes collateral damage. It's a vicious cycle, and that starts and it doesn't stop and it continues to damage the human body. And one thing that it does is it lowers a pituitary hormone called MSH, melanocyte stimulating hormone. And this in particularly is key for the gut lining, for the gut integrity, to prevent leaky gut. And so if someone has a mold exposure, just that lowering of MSH could cause a severe enough inflammatory reaction to cause Crohn's or colitis in a certain subset of people.
And when you talk about mold and toxins too, if you track some of it back to how some of that has come in, it might not just be in the environment or where you live, but also through, I mean, correct me if I'm wrong, but in some cases I've seen there's been a correlation with mold toxins that are correlated to some really heavy, intense antibiotic treatment from years prior as well. There's certain things in the way that mold can come up in the body.
Yeah, it's amazing in food too. So I think that's one of my philosophy is one of the reasons why the paleo is so popular with grain-free is in some people it's eliminating molds because the commonest sources of molds are grains like corn and wheat and rye and rice. And so if people are eliminating grains by nature, they're on a low mold diet. So things like that, peanuts are also a high source, but eliminating mold can be a big deal for certain people in the diet because you can get sources. They actually showed some of the studies on the harmful effects of mold on the gut were children in Africa who were eating grain that was contaminated with mold. So sadly, and it was a retroactive study, so it wasn't that they were feeding them that, but they were checking later and they were showing this massive damage to the gut because they were eating mycotoxins in the food supply. So that just shows you they were having this massive permeability, and their villi would atrophy, so they would have no absorptive surface. And it was all because of mold in the foods. So it's pretty amazing.
Look, thank you so much for sharing that. And for you listening, a lot of hope here. and a lot of awareness, and hopefully it's opened up, you know, the whole field to tend to your healthcare and look for triggers and what you can actually do. You've given us some great tips actually, just to get really on the healthy bandwagon. That once you start to feel really good, there's no reason not to. When you just do, you just do. And you gave us some structure of what we can actually do and action today. So how can we keep in touch with you?
Yes, thank you for asking. And I just want to mention, just literally last month, I wrote 3 articles, 1 on leaky gut, 2 on inflammatory bowel disease. So all this stuff I'm talking about today, I actually just literally put blogs out on it. So it's written down. If you want to visit, you can just visit my website. It's Jill Carnahan, Carnahan.com. So JILLCarnahan.com. And all of it's there. Just hit my blog, and you can even search for inflammatory bowel and it'll come right up.
Thank you so much. That is awesome. I appreciate you spending the time with us between patients. You're amazing. It's like, you know, it's hard to fathom that someone so dear who serves so many has also been through so much yourself. But what a beautiful way to be able to reach and help and, you know, really connect with people who are going through that. So thank you for being as awesome as you are.
You're welcome.
You're awesome, Dr. Jill. Have a beautiful afternoon.
Thank you. You too.